Happy Friday. It's FAQ Friday with Medicare Bob, Robert Bache, and in this video, I'm going to answer the question, what is the Medicare Part A deductible? Well, the Medicare Part A deductible is a hospital deductible, and it's every time you go to the hospital, Medicare charges $1,340 that you have to pay if you only have Medicare. Now, it's important to understand that this is not an annual deductible. This is per coverage period, so per occurrence. So if you go to the hospital, and you go and you're going to have to pay the $1,340, and you go 3 months later, you're going to have to pay that $1,340 again. Now, so we know it's not annual, but there is something that you need to understand about it as well, which is if you go to the hospital and and you go and you leave and you come back for the same reason, then they can not have to charge you that $1,340 again, because even though you left and you came back, if you're within that 60-day period for the same reason and they admit you again, sometimes the hospital is not going to charge you that $1,340. However, if you go to the hospital, you leave and you come back for a different reason within the 60 days, most of the times the hospital is going to charge you again for that $1,340. So what is the Part A deductible? It refers to every time you go to the hospital, you have to pay the first $1,340 before Medicare pays anything. And it's going to cover you for the first 60 days. If you leave and you come back for the same reason, the same medical issue, then the hospital may not charge it to you again. However, if you leave and you come back within 60 days for a different reason, the hospital has the right to charge you that $1,340 again. And the main thing you have to understand is it's not an annual deductible. It's every time you go to the hospital outside of those 60 days. So if you go to the hospital and then you go again 4 months later, you'll have to pay that $1,340 again. So the Part A deductible for 2018 is $1,340, and it's not annual, it's per occurrence.